Hello, I'm Donna Sellers and I'd like to present some work that was carried out by Eleanor West, a PhD student in our group, showing that chloroacetaldehyde, a metabolite of cyclophosphamide, causes physiological alterations in the urinary bladder. Eleanor's work is supported by an Australian Government Research Training Programme scholarship, and we have no other disclosures. So cyclophosphamide is a commonly used chemotherapeutic used to treat a variety of different cancers. It's also used in immunotherapy for disorders such as rheumatoid arthritis, lupus and interstitial lung disease, so quite widely used in clinical practice. However, patients who have been treated with cyclophosphamide often experience debilitating urotoxic adverse effects, including urinary frequency, nocturia, urgency, pain and cystitis, which significantly impact on patient quality of life. These urotoxic effects have traditionally been attributed to the urinary metabolite of cyclophosphamide, acrolein. However, there is another significant urinary metabolite, chloroacetaldehyde, that may contribute to this urotoxicity. So the aim of our study was to investigate the effects of intravesically administered chloroacetaldehyde on bladder function using an ex-vivo whole bladder preparation. We isolated bladders from female C57 black 6 mice and attached a three-way catheter via the urethra. The catheter was connected to an infusion pump to allow fill-in and a pressure transducer to record intravesical pressure. An outflow tap also allows us to collect intravesical contents. We filled the bladders with either chloroacetaldehyde at 100 micromolar or saline as a control to a pressure of 20 millimeters of mercury, using a filling rate of 30 microliters per minute. After a 1-hour treatment period and in the continued presence of chloroacetaldehyde or saline, we measured a number of physiological parameters. These included spontaneous activity, bladder compliance during fill-in, and stretch relaxation or accommodation to fill-in. We also investigated nerve-evoked contractions of the detrusor using electrical field stimulation to depolarize the efferent motor nerves, and investigated the neurotransmitters involved in these contractions. Differences between control and chloroacetaldehyde treated bladders were compared using one-tailed unpaired student t-test, and p less than 0.05 was considered significant. We found that intravesical application of chloroacetaldehyde increased bladder compliance at pressures above 12 millimeters of mercury, seen here on the left. Control bladders are shown in orange and chloroacetaldehyde treated bladders are in pink. You can see the significant increase in compliance following chloroacetaldehyde treatment. The amplitude and frequency of spontaneous bladder contractions were also enhanced by chloroacetaldehyde, seen here on the right. Again, control data is shown in orange and chloroacetaldehyde treated in pink. Figure B shows the amplitude of spontaneous contractions, whilst Figure C shows the frequency over 2 minutes. Both were significantly enhanced by chloroacetaldehyde treatment. Depolarization of efferent motor nerves of the bladder by electrical field stimulation produced frequency-dependent contractions, shown here on the left as increases in intravesical pressure. Responses at the lower frequencies were enhanced in the chloroacetaldehyde treated bladders. We also investigated the neurotransmitters involved in these contractions using a number of antagonists. You can see here on the right the control data and the chloroacetaldehyde treated bladders. The black bar is the control response, and you can see the effect of the nitric oxide synthase inhibitor LNNA, which decreased the response slightly but significantly only in the chloroacetaldehyde treated bladders. In contrast, the muscarinic receptor antagonist atropine and the purinergic receptor agent alpha-beta-methylene ATP decreased the response substantially but by a similar amount in control and chloroacetaldehyde treated bladders. Our interpretation of these results is that key physiological parameters are altered by the presence of chloroacetaldehyde in the bladder, with bladder compliance and spontaneous activity being enhanced. In addition, chloroacetaldehyde enhanced neurogenic contractions of the bladder at the lower frequencies of stimulation. These lower frequencies of stimulation are thought to invoke mainly ATP release. However, the percentage contribution of acetylcholine and ATP to nerve-evoked contractions at higher frequencies of stimulation wasn't altered by chloroacetaldehyde. although nitric oxide does seem to play a slightly greater role in bladders following administration of this agent. So in conclusion, intravesical application of the urinary metabolite of cyclophosphamide, chloroacetaldehyde, does affect the pharmacological and physiological functioning of the mouse urinary bladder. Such changes may explain the potential contribution of this metabolite to the urotoxic adverse effects experienced by patients following treatment with cyclophosphamide. Thanks for listening to our video abstract, and please do leave any questions in the chat forum.